Welcome to Diabetic Retinopathy. What is it, and are you at risk? Diabetes Eye Health. My name is Casey Kaufman, and I'm pleased to serve as moderator for this program. I'd like to introduce our two speakers, Dr. Timothy Murtha and patient presenter Evelyn Smith DeMille. Dr. Murtha is a clinical instructor in ophthalmology at Harvard Medical School, and he treats patients at Joslin Diabetes Center in Boston, Massachusetts. Dr. Murtha will talk to us about what patients with diabetes can do to reduce their chances of getting diabetic retinopathy. He'll also talk about how patients with diabetic retinopathy can keep their disease from getting worse. Evelyn Smith DeMille has diabetes and will discuss her experiences with having her eyes examined.
Let me give this to you here, and with your left eye, you want to look through that. When you look forward, what's the smallest line of letters you can read up there?
Okay, the smallest line I have H, C, K, H, D.
Beautiful. Now when I do this, and you look through those pinholes, does that make it better, worse, or no different?
It makes it better.
And what's the smallest you can do?
Okay, I've got H, Z, C, K, D. The last letter, I see that as the last two, H, D.
Beautiful. It is an HD. Good job. All set. And with your left eye, can you see that black dot in the center of the grid?
Yes.
When you look at that dot only, nowhere else, are the lines straight or crooked?
They're straight.
Beautiful. And turn it back to the right eye for me. Same thing. How does that look? Straight or crooked there?
Okay, I do have it at very crooked.
A little distorted?
Yeah, sure
okay.
is.
Okay.
We just saw how straightforward and simple it is to have an eye exam, but for many patients, there's often a sense of anxiety and fear that goes along with having their vision checked. Now that you've seen some different parts of an eye exam, Evelyn, our patient presenter, will give us her perspective. Evelyn, it is so wonderful to have you with us today, and so important to hear from a patient, I believe, a patient with diabetes. So let's talk about your experiences when it comes to having eye exams.
I'd be happy to do that. I think that it's really important for people who have diabetes to get regular eye exams. And I want everyone to know that I've had diabetes now for 46 years, which is a pretty long time.
How often do you have eye exams? Has it changed at all during that period of time? And
yes, actually, it has changed. When I started out having my eye exams, it was a yearly exam. And then probably somewhere around maybe 5-6 years or so ago, I was asked to come in every 8 months. I was and am developing cataracts, and my ophthalmologist and my optometrist want to keep check on that. So I was coming in every 8 months, and now I am being seen every 6 months. I like the 6 months better than the 8 months because it's easier to figure out when you have to come back. But I think that there is, for me, every time I go in for an eye exam, a good measure of anxiety.
But you talked about, it's interesting because it's sort of, having it every 6 months makes you feel a little less anxious than having the 8-month period. Do you feel that you're being empowered, that you're being more proactive?
I like having, I would much rather be on top of the situation. Again, you know, the old public health adage, an ounce of prevention is worth a pound of cure, is absolutely right. And by having someone look into my eyes and see things that I certainly can't see that might be going on gives me the reassurance that we're still on the right track. It also, just having that team, and for me, my particular team is made up of an ophthalmologist and an optometrist. Other people might have an ophthalmologist and a technician. The technician optometrist, the optometrist in my case, when I go in, will do a typical eye refraction to test my vision and see if there's any changes in what I'm seeing. And then he will do a test for glaucoma. And then usually the last thing that he will do is he will insert the eye drops. The first eye drop that goes in is an anesthetic, and that actually does give you a little bit of a pinch. But after that, there's absolutely no pain that comes out of the eye exam.
But you are dilated.
Well, it does. The dilation does take a while after the optometrist or the technician puts in the eye drops. The patient will usually go out and sit in a waiting room for a period of time so that the dilation actually happens
And
full
how
enough.
does that feel? Is it a sense of heaviness? Is it? It's
No,
different in
there's
different
absolutely, there's no sense of it at all. But what the patient experiences, anyone who has a dilated eye exam, is that over that period of time your eyes get blurrier and blurrier, and it actually becomes harder to do things like read. And it is not a comfortable feeling because you're not seeing clearly, very, very, very obviously. But then when the ophthalmologist does the exam, his or her exam of your eyes, it is, again, a sense of reassurance that this expert is looking and making sure that things are the same, or if there's something that's different, helping to figure out what's the next step. And that's, again, for me, so important that I feel part of that team.
Knowledge is power, right?
Absolutely,
And feeling like
absolutely.
you're empowered and part of it. How long did that whole process that you walked us through take?
Well, it generally depends on how busy the clinic is, but it generally
We'll give you the benefit of the doubt. They see you right away. They start the process. You've waited before you're driving home.
Well, the actual exam itself probably takes an hour, maybe a little more.
Do you get feedback right away from the doctor? Do they tell you what?
Absolutely, that happens for me. Yes, absolutely.
And walk us through that. So you know, that uncertainty, that dread that you're kind of sitting there thinking, is there a change? But you do have resolution pretty much immediately. How does that feel when you get the results back?
Up to this point, it has felt wonderful because I have very little diabetic retinopathy. The main problem right now for me is the cataracts. And my ophthalmologist thinks that within a year or a little more, I'm going to be needing surgery. But, I'm 69 years old now. Wow. I'm not that young. And it's something that happens. But for me, I don't know how I would feel if she told me, Evelyn, there's something here that we need to take care of, and we need to take care of it now. I have lots of friends who also have diabetes and are seen at Joslin, and I know that they've gone through that, and I know it is very, very difficult to hear that. But the fact that the experts are there, that there are eye experts that can treat this, and doing what needs to be done, again, preserves, hopefully, most of the vision that you have.
I mean, you're preaching to the choir. Does this sound like is this a model patient?
We wish we had everybody like Evelyn.
I bet you do. I bet you do. And, it seems to me that you're sort of the absolute sort of dogma for having regular checkups. For you, it's 6 months, but both of you, would you say it's typically a yearly, or you just listen to your team and your doctors and follow their advice?
It's really variable from patient to patient, and it really depends on the situation that presents itself. So I will see patients as frequently as every 2 or 3 months, and sometimes as infrequently as every year. I will never let a patient go longer than a year, and I always tell my patients, you can get a pretty good sense of how I feel about your eyes. The more frequently I want to see you, the more worried I am. If I'm seeing you once a year, you're in great shape.
Well, I'd like to thank you so much, Evelyn. I think the power of your message underscores the importance of being part of the team and taking the initiative and control. So thank you again.
I believe in the product.
I can tell. It's important to note that most insurance plans cover a yearly eye exam, and I would like you to take a moment to review this slide for other patient resources. And I'd like to ask our viewers to please also take a moment to answer our next poll question. Has your primary care physician recommended that you have an eye exam because you have diabetes? And now Dr. Murtha will join us again to talk about how you can take control of your eye health in order to help prevent diabetic retinopathy. Dr. Murtha.
Thank you again, Casey. So, taking charge of your eye health. We've all heard from Evelyn how important eye exams are. That is step one in taking charge of your eye health. Your primary care doctor, your endocrinologist should be recommending this, and the vast majority do. If they don't, it is your responsibility to say, I need an eye checkup. They can refer you to doctors that they work with, or you can choose a doctor of your own. The only caveat to all of this is I would ask you to make sure you are having your eye checkups with someone who is trained in both the diagnosis and treatment of diabetic eye disease, and this would fall under the purview of most retina specialists. Just as an aside, when you visit your primary care doctor's office, your endocrinologist, your optometrist's office, it is likely that they're going to have imaging technologies in their office that they will offer to you to help assess the level of your diabetic retinopathy. And I give kudos to these. This is a wonderful technology. There are some systems that are excellent and provide excellent photographs. There are some that are less than ideal, but we can still determine what we need to determine. The benefit of these systems is they will let us find patients who have significant disease and triage them into appropriate care sooner than they otherwise would get there. For those who, upon review of their pictures, show little or no disease, they can be referred in a non-urgent manner for routine eye checkups. Next step, interventions. Once again, we're talking about blood sugar control here as the primary intervention. You need to work closely with your medical team to work on blood sugar control in any manner possible. This also includes blood pressure, cholesterol, anemia, etc. Beyond that, there are interventions that your eye doctor may recommend once we have maximized your medical care. There are cases where observation may be appropriate, where the disease is borderline. It may or may not need treatment at some point, but we can often give you the benefit of the doubt, particularly if we know that you are striving for better sugar control, better care. If observation doesn't work, then there are treatment modalities that are very effective today. Might include injections in the eye. Now I know this sounds a bit draconian, but it is extremely effective. The only problem with injections is they are time dependent. You really need to be followed up for these injections, and they need to be done on a monthly basis. Beyond that, perhaps injections are not appropriate for your care. Then laser treatment might be appropriate, and ultimately surgery may be appropriate. Communication, that's the next most important thing. You need to be able to communicate with your doctors. They need to know when new symptoms arise, changes in vision, loss of vision, blurry vision. These can all be very important. Understand that people with diabetes also get other problems. They are not excluded from other eye diseases. You should not assume that symptoms are diabetes and ignore this. You should bring this to the attention of your specialist. Let them decide after examining your eyes. Lastly, it is extremely important, and you should remind your ophthalmology team to communicate with your doctors, your primary care doctors, your endocrinologist, your cardiologist, the whole team. Because what your eye doctor sees happening in your eye may very well suggest that your doctors need to be more aggressive in their care, in your medical care, pardon me. Lastly, education. You are as much a part of this process as your team is. You need to educate yourself. There are many resources available for you. Your local library has many books that could be very helpful. Your doctor's office often has pamphlets and literature that can help educate you. But in 2015, the internet provides the best resource. There are endless ways to learn about diabetes on the internet. I would ask that you stick with well-known and well-vetted sites. These would include the government sponsored sites such as the National Eye Institute, the National Institutes of Health. They provide excellent information. The well-known and nationally recognized clinics, the Mayo Clinic, the Cleveland Clinic, the Joslin Diabetes, all provide excellent information on their websites. The American Diabetes Association, the Juvenile Diabetes Foundation are all also wonderful resources for learning and following up on your diabetic eye care.
Thank you to Genentech for their support of this educational program. I'd like to remind you that additional videos are available at diabetesEyehealth.com. Thank you so much for joining us.